Okay, welcome back. It's been more than 3 years since COVID-19 first plagued the world. The virus has killed more than 1 million people, and that's just in this country, in the United States. It continues to infect people every day. But now, believe it or not, the COVID public health emergency is officially over in the United States, meaning all emergency measures implemented by the Trump administration, such as additional funding, relaxed insurance coverage, and free testing, all of that, folks, coming to an end. And we might say good riddance, but we're going to find out from our next guest. Joining me now, Dr. Mikhail Rashowski, better known as Dr. Mike. He's a board-certified family medicine doctor with over, get this, 23 million social media followers. That's a big deal. Okay, Dr. Mike, tell us, so it's over. How does this official pronouncement, what's significant about this for us as prospective patients?
Yeah, as prospective patients, I think that the less we worry about what's happening on the governmental level and instead focus on what we can control as individuals, that's where we're going to get better outcomes. Because just like I tell my patients, when we put a diagnosis for them, whether it's a physical health or a mental health diagnosis, this label does not define them. So just because we're saying that COVID-19 is no longer labeled as a public health emergency, it doesn't mean that it's not a virus that's still going to be around. It is in fact going to be around. It is changing from a pandemic to an endemic virus, meaning that we have to learn how to live with that. And part of living with a virus means understanding ways that we can keep ourselves safe, which means doing the basic things of personal hygiene, washing our hands often, making sure that when we're sick, we stay home from school, from work, in order to decrease the spread of these viruses, and most importantly, getting ourselves vaccinated.
Okay, Dr. Mike, we have a panel. And they have questions. Julia.
Dr. Mike, this is Julia Manchester from The Hill. Do you think we're starting to look at COVID-19 as something that's in the family of the flu or the common cold?
I hate to relate it to other viruses because it's never as simple as, oh, this virus is quite similar to this one. We could talk about it in a variety of different ways. But the way that I like to think about COVID-19 being different from these viruses is that we've seen the devastation that it caused, not just here in the United States, but truly globally. We're talking about millions of people affected, millions of lives lost, so we can't take it lightly. What instead we should be doing is thinking about how to be proactive for the next potential pandemic so we can be better prepared.
Okay, Johanna.
Yeah, Dr. Mike, thank you so much for joining us. You know, as we've seen this pandemic get so political, what are you seeing on the ground with patients? Are they taking the vaccine? Should people still be getting the vaccine? What is your advice that you are actually giving families?
Yeah, I think the majority of my patients have been fully vaccinated, including receiving their boosters, because of my discussions with them, my explanations for the risk factors that they're exposed to. But really, this should be a discussion between patient and doctor in terms of understanding what risks one might face in order to understand the benefits of receiving one of these new updated boosters that covers the more modern strain of this virus as compared to the original series, which we call the primary series, against the initial COVID-19 variants.
And Dr. Mike, one more question for you. Along the lines of what Johanna was asking, are people just sick of hearing about the COVID-19 virus? I mean, how much damage has been done after all the last 3 years and the doubting and the skepticism and the misinformation and the in some people's views, the aversion to any risk that closed schools and caused so much disruption in society? How does that play out on the ground when you are meeting with patients in your office?
They absolutely have a high level of COVID-19 fatigue. But I think what we need to do is turn that level of fatigue into a level of empathy and understanding, meaning that as we move forward with COVID-19 or potentially another viral threat, we need to understand that we need to be proactive here. We need to think about how we can better react in the future, because honestly, our reaction to COVID-19 was subpar. And obviously, I'm talking about it now after the fact, but we can use this, what we call a post-mortem analysis, of finding out what we did wrong to figure out how we can respond better. And specifically talking about the COVID-19 fatigue you mentioned, I run
Yeah.
a very popular YouTube channel with over 10 million subscribers. And I actually have watch time retention charts to see how much people are watching each second for my videos. The second I mention COVID-19, that watch time starts to drop.
Thanks for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to subscribe. Click the red button to get more of News Nation's fact-driven, unbiased coverage.